Dicom is the international standard protocol for the management and transmission of medical images and related data. Dicom is widely used for most types of medical imaging, for example, magnetic resonance imaging (MRI), computer tomography, CT scans, mammograms, and ultrasound. The Dicom standard is concerned with 5 main functions in medical imaging. The first one is to transmit and process images and related data between endpoints. Second is to query and retrieve files. Third is to perform specific actions like printing or archiving. Fourth, to support digital imaging workflows. And the last one is to provide high-quality images for diagnostics.
How does Dicom works? Dicom works through two main components, which is Dicom file format and Dicom network protocol. These two components work together so that the images are in standardized format and the image exchange is also standard. Medical equipment produces Dicom files which contains medical images, information regarding patients and acquisition data. Medical practitioners will use Dicom Weaver software to open Dicom files in order for diagnosis purpose. Network protocol is used by medical imaging applications to exchange information and also to look for imaging studies in the archives and import them to the workstation so that they can be viewed. Advanced protocols are also available for scheduling procedures, reporting statuses, and sharing tasks between doctors and imaging equipments.
One of the advantages in using Dicom is we can produce a clearer image as it can manipulate pixel shade, brightness, and contrast. The image can also be zoomed in and zoomed out easily to enhance the view of observation, so it will help a lot to improve the diagnosis. Second advantage of using Dicom is Dicom will produce fast image. It takes only a second to produce image compared to producing the X-ray film, so it helps to enhance the capacity receipt and improve the workflow. Dicom is a universal standard. It is because all current digital images produce Dicom image. These systems are recognized by most of the software. This standard characterizes the configuration or medical picture that can be traded with information for clinical use. The other advantage is more information comes with the Dicom hidden. It is because the image produced is including steps where image-specific information and patient information is saved as the Dicom have a large data storage. Plus, every system that read the image have a possibility to access the data, so the data can be transferred easily with a better quality and less error.
Next, I'm going to explain about the disadvantages of digital imaging and communications in medicine. One of the main disadvantages of Dicom is the inconsistency in filling all the fields with the data. In other words, some image objects are often incomplete because of some blank fields and fields with incorrect data. Besides that, Dicom will cause problems if an image from different manufacturer is displayed. This is because of the variation of amplitude ranges in various imaging equipment with the same allocated bits. Due to this, displayed image could be underexposed or overexposed with poor contrast. Other than that, Dicom requires indexing for a high viewing performance. Without a correct indexing process, the additional files would not be added to the database correctly, which will cause the objects to create issues somewhere. Moreover, the Dicom header might be difficult sometimes to be executed. Since the header tags in Dicom header includes optional tags and essential tags, it is hard for the scanner vendors to choose the tags.
The last part is about the importance of Dicom. Dicom is used to store, exchange, and transmit medical images, enabling the integration of medical imaging devices from multiple manufacturers. Dicom will act as a universal standard between imaging devices and their archive system to reduce the cost rather than purchasing extra equipment. Dicom not only can save images but also record its informational content to ease the processing and interpreting of the image data.